And I was going to another urologist for a number of years, and we were keeping track of my prostate condition, my overall urological situation. And in the last few years, we noticed the prostate started to enlarge. So once it started to enlarge, we increased my visits to the urologist from annual to every 6 months. And then in the 6-month intervals, we kept checking it, and it still continued to enlarge. My PSA levels were high, so we did a biopsy, and the biopsy came out negative. Everything was fine. And so he had a little standing joke when he'd come back. When he gave me the lab results, he said, "Oh, you dodged the Grim Reaper." I'm glad to hear that. But about 2 or 3 years of doing biopsies, he came back and said the results were positive. And I'm like, "What do you mean positive?" He says, "You've got prostate cancer." So naturally, I'm thinking, gee, he didn't dodge the Grim Reaper this time. So I'm like, oh my God, that's pretty devastating news. So my brother, who had the same situation, he had already had prostate cancer and surgery. And his surgery, he was never the same. Sexually, he was not the same afterwards. So I didn't want that. So I heard about this robotic procedure. So I did some research. I have some friends of mine in the medical profession, and they recommended Dr. Michel. I don't want to chip away at it. I don't want radiation and nothing. I want to get rid of the thing. So that's what we did. We scheduled an appointment. And he was actually kind of meticulous. He said, because I was a little bit overweight, as I am now again, but he said, I need you to lose about 15 pounds because I've got to go through all this meat to get to your inside. So I need you to lose about 15 pounds before the surgery. And I don't want you to lose it on your own. Hire a trainer. He said, you hire a trainer, tell him your goal, and he will see to it that you lose that weight. So we did that. My wife and I hired a trainer, and we lost the weight. I lost the weight before the surgery, most of it. We had the surgery, and subsequently, everything went fine. Subsequent to the surgery, I had a recovery time I was in the hospital for 3 days. That and some internal therapy from Dr. Michel's office over a period of about 6 months helped me get progressively better. The good part about it all was that sexually, that was one of the things he made a big point of, to make sure that my wife and I remained sexually active, to make sure that everything's back in order with the new normal. So he prescribed medication for me to enhance my sexual performance, and I took it for a while. I wasn't taking the sexual enhancement medication that frequently, but fortunately, my wife and I were able to work it out to the point where we don't really need it that much. So I've got a prescription now that I haven't filled in a while, but sexually we're both doing well. So that's a big plus. I think for starters, men in general need to get checked. I know in the African American community especially, a lot of men feel that it's an assault on their manhood to have another man take a finger and put it in your rectum. Well, you got to get over it, because that's one way for the doctor to find out whether the thing is enlarged, because it will press against your rectum. But even if you don't want to do that, go get a blood test to get your PSA tested. If you have the finger bothers you, don't die as a result of it, go get a blood test. The blood test will confirm even more than the finger will. My surgery was a year and a half ago, and within 6 months of my surgery, I bought a motorcycle for the first time in my life. It's not a comfortable motorcycle, it's a chopper. So it's got a very hard, uncomfortable seat, but it looks gorgeous. Thank God for the successful surgery and everything. I'm able to ride wherever I want to go. I ride all over Southern California on my new bike that I love, and my condition is, it's inconsequential as far as the surgery is concerned. You wouldn't be able to tell that I had the surgery.